What's the best treatment for lower back pain? Is that tingling in your wrist a warning from your body that you need to see your doctor? Are you eating the right foods every day? When you're looking for answers to your general health questions, just ask Dr. Jim.
Hello, thank you for the introduction. My name is Dr. James Fedich. Thanks for tuning in for this episode of Ask Dr. Jim. We aim to answer those medical questions that people have that never get the quite answered. We're going to answer questions that we receive from our viewers in formats such as this. And now, along with our first question, is going to be our lovely Nicole.
This week on Dr. Jim, the topic will be manipulation under anesthesia. Dr. Jim, for all our viewers out there, can you tell us what MUA is? We've been getting a lot of questions about it.
We have gotten a lot of questions about MUA procedures lately, and I think it bears worth explaining the procedure a little bit more. So MUA stands for manipulation under anesthesia, and what it is exactly what it sounds like. While the body's under anesthesia, we manipulate the joints, muscles, and ligaments to allow more mobility and movement. What we use it for is several different things. People are too tight to be manipulated in the office, there's too much scar tissue, too much tension, or too many other different issues that we're not able to move the joints in the way they need to be moved. With the MUA procedure, we're allowed to restore normal range of motion, get people back to work a lot faster than other procedures without the risk of surgery or opening up the body. So MUA has been around for quite a while, but it's gaining much more popularity lately due to a few reasons. One is that anesthesia becomes much more safe for the last few years. MAC, or moderate anesthetic care, has become much more popular as anesthesiologists are able to monitor the body very closely, so you're not totally under sedation. It's a light form of sedation, actually the same as a colonoscopy or similar procedures. Allows the body to be relaxed, but still have your natural guarding mechanisms to help prevent any types of injuries. While the body's under this anesthesia, we're able to move it in ways we couldn't in the office due to guarding or too much pain. Doing the procedure this way allows a much greater effect to happen in just a shorter amount of period of time. Great question.
Our next question is from Ron from Hackettstown. What about frozen shoulder syndrome? What exactly is it? And how can an MUA help?
Well, frozen shoulder is one of the most popular procedures that are done for an MUA procedure. Talked a little bit about this before, but just to go back over it, your shoulder is a basic ball and socket joint. When people say that, what that means is that there's a socket holding in a ball, so when your shoulder moves, that ball rotates within that socket. That's the reason why our shoulder is able to move much better than any other joints. Our wrist can kind of only move in a few directions, but your shoulder can really move in 360 degrees because of that ball and socket. Now, what we say is when we get mobility, we give up stability. So what that means is because the shoulder is able to move so well, it's not the most stable joint. So everyone's kind of heard of someone's dislocated their shoulder, and that's why it's just not as stable as some of the other joints because we're able to move it more freely. But specifically about a frozen shoulder, what happens is little adhesions or scar tissue builds up between the ball and the socket in there. There's a lot of debate as to why that happens. We do see it after injury sometimes. People just aren't moving the shoulder, so it just kind of freezes up. The scar tissue builds up around it. There's been plenty of spontaneous cases. I've seen them, lots of other doctors have, where it just forms on there all of a sudden for no real explanation. So those little adhesions build up around there, and sometimes a physical therapist or a chiropractor or other profession can get that movement back and break up those little adhesions. But typically it can be very painful. I've seen it a lot in my own practice. It's very painful to move it around and break up that scar tissue. So a lot of times doing it under anesthesia is the better approach. It's been done by orthopedists and chiropractors for 70 years now. As that joint freezes up, when you're under sedation, we can break up all those adhesions without there being pain. I tell patients we could typically do it in the office as well. It would just take weeks and weeks and be pretty painful, or you can usually just do it under anesthesia in 20 minutes and get it done and fixed right the first time. Once those adhesions are broken up, that ball will move freely again in there, but the key is to keep it moving afterwards and doing your physical therapy or follow-up care, because if you don't, that'll freeze right back up again, and I've seen that as well. So that's a good question. It's one of the most common procedures that we do for a frozen shoulder, and it can be very beneficial.
Some people get MUA after a knee surgery. Can you tell us a little bit more about that?
The question is about post-knee surgery getting an MUA done, and this is very common, a little bit different than some of the things we've talked about. This is more in the orthopedic realm. So what happens with the knee procedure, there's two joints in there, the upper and lower part of the knee, and they move around freely. There's a lot of different surgeries they do in there, and we won't get into all that now, but after a knee replacement or major knee surgery, you're not allowed to move those two halves for quite a while. So what happens is even once we start physical therapy a few weeks later, they start freezing up. So it is kind of like we just talked about with the frozen shoulder, because when they do a major knee surgery, you're not able to move it for a few weeks. And even once you start walking, it's just not moving all the way. Those little adhesions build up, just like we were talking about with the shoulder, and it slowly lets less and less motion out of that knee. So instead of being able to bend it fully back and forth, it's less and less and less, and it starts kind of freezing up. And the scar tissue forms very quickly with all surgeries, but particularly it seems to be with the knee. We'd have to ask an orthopedist for a little bit better answer, but within hours of the surgery, there's actually the starts of scar tissue in a knee surgery, and as it's just a few weeks of not moving it, not using it enough, it builds up over time. So it's a very common procedure done in the orthopedist office more often. They'll do the knee surgery, follow up a few weeks later. If they're feeling those scar tissue and adhesions building up, they'll schedule an MUA procedure to break that up and get that knee moving more freely again. So that's been practiced for a long time. Ever since they've been really working on knees, they've noticed them freezing up. And it's almost a standard a few weeks later, if it's not moving where it needs to move, that the orthopedist will do an MUA. Now, again, a chiropractor or other professional could do that, but that is typically done by the orthopedist. They did the surgery. They know what's going on in there, and they're usually the ones who go in afterwards and break up all that scar tissue in there. It can also be done years after the procedure, but typically they'll do it within a few weeks afterwards to make sure not too much scar tissue forms up. Well, another question that I hear an awful lot in the office: do you need to go to a chiropractor forever? And of course the answer is no. You don't have to do anything forever except maybe eat, drink, and pay your taxes. But the question, it gets a little more complicated. Once you go to a chiropractor, do you have to keep going? The answer, again, a short answer is no. Long answer, it depends. So another analogy I give people is people lose weight and they go to a gym to lose weight and eat better. Now, if you lose weight by eating better and exercising for a couple months, you lose 20, 30 pounds. If all of a sudden after a couple months you start up exercising and you stop eating well, you're going to gain back that weight, right? Pretty simple analogy. Well, same thing that happens with chiropractic. Unfortunately, people hurt their backs. They come in here, we get their back feeling good after a month or two, and then they go back to doing all the bad things they were doing that hurt their back in the beginning, and their back problem comes back in 6 months. And that's where sometimes that comes up where people say, do I have to keep going forever? Well, of course you don't. And a lot of people take care of themselves, do exercise, things like that, and their spine stay pretty stable. They don't need to see a chiropractor that much. Me personally, I'm a very active guy. I see my chiropractor every couple weeks to keep my spine in shape, but I run, I bike, I go to the gym, I do things that put stress on it. So it depends on what kind of shape you want to be in. The other analogy I give people, it's like water. Nobody ever says, oh, once you start drinking water, you got to drink water forever. Of course, you want to hydrate your body, take good care of your body, and drink water every day. So anything brushing your teeth, a dentist tells you got to brush your teeth every day. You don't complain about that. It's just something that you have to do. Now, you certainly don't need to see a chiropractor every day. Almost nobody needs to do that. Usually in the beginning, people do see us regularly if their problem is worse. But then down the road, it's just a once in a while thing. I have a lot of patients that go months without seeing me. Even a couple times a year, they'll come in just to keep everything in good shape, keep their joints moving, lubricated, keep things loose. Other people more active. I have a patient who's a triathlete. He's in here every week. He bikes 20, 30, 50 miles in a day, sometimes runs 20 miles a day, bikes 20 miles a day. He doesn't really miss a week without coming in. You can imagine the stress he puts on his body. For other patients I don't see for 6 months, a year on end, they take good care of themselves. They just come in for a tune-up now and then. So short answer is no, you don't need to see a chiropractor forever. Long answer is, depending on how well you want to take care of yourself, it's something that you want to do. The other thing I often tell people about, it's kind of like a car. You always change your oil. You spend a lot of money upkeeping your car. People don't change their oil, don't take care of their car. They wear out a lot faster. So I tell people, your body's the only car you're ever going to get your whole life. People spend a lot more time and money sometimes maintaining their cars and their bodies. If your car breaks down, you can always go buy a new one. Once your body breaks down, you're not going to get a new one. So it's best to take care of it. It's the only one you got. But good question. Thank you.
Thanks for tuning in to this week's episode of Ask Dr. Jim. Submit your questions by email to info@villagefamilychiro.com or by mail at Ask Dr. Jim, Post Office Box 333, Alamuchee, New Jersey, 07820.